How's the royal family? I pray that everyone is doing well. Well, my royal family, what I'm about to report is quite tragic and sad. But before I get into that much deeper, um, it has been reported that always, whatever type of disease out, that black people statistically get it more than anyone. And they've been saying this a lot about coronavirus, but they won't show actual data. They won't even show a actual breakdown of the race of people and the ages, and if it's male or female, they won't show that. Now, we do know when coronavirus, well, I say personally, when I heard about it, the epicenter at one point was in Italy, and they said that white males over 50 was getting it more than anyone, males period, and dying. But as time go on, they always like to make us the face of. And if these things are true, because they have said that about HIV and anything else you can look up, why they don't put the actual money in our community to deal with these so-called health issues that disproportionately that the African American community, they claim, continue to get. Also, in that process, when we are dealing with our health and go to the health professionals, and I've had my experiences, I live in chronic pain. I'll get into that just a bit. And, you know, they're always casting doubt. So, you know, me living in chronic pain, they have questioned, are you really in pain? And you can't measure a person's pain by looking at them. So they figure that, especially if you are a darker hue, and I am on the latter end, I'm extremely light-skinned, that especially our darker hue brothers and sisters, that their skin is so thick that they possibly couldn't feel the level of pain of the enemy. So they go out of their way to make sure they have the necessary medication to address their pain. And then when it comes to dealing with us, and I've had my experiences, they give you as little pain medication as possible because they figure you trying to get high on it or you, unquote, trying to sell it. You know, it is what it is. So, I was looking at these, you know, numbers that they threw up, which means nothing because people are throwing up all types of whatever. But as we continue to go on this journey, one of my subs...
A local family is demanding justice. They say a 23-year-old woman is...
Okay, we'll get to that in just a second. So one of my subs had made me aware of a story up here in the Bay Area where, I mean, the neglect, this is so atrocious and this is such a sad story. You see this beautiful queen's picture that I had put up. You know, this is total neglect. This is a classic case of whoever she encountered didn't address the situation properly. And so, you know, it's tragic what I'm about to present to the royal family. So let's get into this first video. And let's take it back some. It popped up on me. All right.
Family is demanding justice. They say a 23-year-old woman is now on life support after complications from COVID-19 and a pregnancy. Let's turn things over to ABC 10's Carlos Serrano right now, who is live for us at Sutter Medical Center in Sacramento. Carlos, tell us what happened.
Well, Kirsten, very serious accusations against Sutter Health officials and doctors from Kiana Hankston's family. A press conference, in fact, just wrapped up a few minutes ago here right near the front entrance. The family of the 23-year-old gathered at Sutter Health demanding justice. They say Hankston, who was 6 months pregnant, went to the hospital for stomach pain on July 19th. She then tested positive for COVID-19 and had an emergency, or had to have an emergency C-section. They say she was recovering well, but a few days later, doctors said she needed surgery to remove a blood clot. The family says it did not follow proper procedures, resulting in Hankston now being on life support. We did hear from the family, who said things would have been differently had she not been black. We spoke with several family members, in fact. Now, a Sutter Health spokesperson sent us the following statement regarding this, saying, quote, "Providing compassionate, safe patient care is our highest priority and the core of our mission. Our commitment to patient privacy, as well as legal requirements, prevents us from providing additional information," end quote. Now, family members told me here just a few moments ago they've been trying to reach hospital administrators for quite some time now and haven't been able to make contact in person. Kirsten.
Carlos, that is a devastating story. I know that family is really going through it this morning. Thank you for bringing us that.
All right, my royal family. Let me take this down quick so I don't get any pop-ups. So, as we go on this journey, my royal family, this is a hard one to swallow. I'm just preparing the royal family because I'm going to go much deeper into the details of the other neglect that our queen received, and now she's on life support, and her baby, if I can recall, I think also has COVID-19, but I can't quite remember. So let's just get into it.
So family blames racism, not coronavirus, for new mother being on life support. As Kiana Hankston lay brain dead Monday inside Sutter Medical Center, Sacramento, outside her family declared that, while the coronavirus led her to seek care at the hospital, it was not the respiratory illness that put her on life support. In less than a day, she went from laughing and telling me about being a new mom and how bad she was ready to come home and get away from the mean staff that was treating her like she was the plague, said Hankston's sister, Regina Gadlin. Yes, my sister was infected with COVID-19, but let's be clear that COVID is not responsible for her condition. It is the staff that disregarded her life and winged her procedure. In a statement emailed to the Sacramento Bee, Sutter officials said, "Providing compassionate, safe patient care is our highest priority and at the core of our mission. Our commitment to patient privacy, as well as legal requirements, prevent us from providing additional information." Hankston was about 6 months pregnant when she arrived at the hospital, and doctors told her they would have to perform a cesarean section to prematurely deliver her daughter, Melody, her family said.
Just a quick word from our sponsor.
It's finally nice out. If you find yourself in a situation where Plan A falls through, there's Plan B one step. When taken within 72 hours after unprotected sex, Plan B emergency contraception helps prevent pregnancy before it starts. Find it yourself in the family planning aisle. Use as directed.
Gadlin, who works as an operating assistant at another local hospital, said she called her sister every 2 hours, and since she understood the language of hospitals, their mother, Karina McDaniels, asked her to be the family member to check in regularly with hospital staff. Hankston developed a pain in her abdomen, and when she showed her bare abdomen to Gadlin on FaceTime, she agreed that it looked unusually swollen. Doctors later said Hankston developed a hematoma, but that it was something they could treat with a bedside procedure. Gadlin asked whether the procedure would require anesthesia, and she said a doctor told her no, that they would require a completely different approval for that. The next time she spoke with a doctor, however, she learned that her sister had been intubated and given anesthesia to allow doctors to do surgery because she couldn't keep her composure. Panic overtook Gadlin when she learned that her sister had been intubated again. When COVID-19 initially surfaced in the United States, treatment called for intubation fairly early in the process, but doctors have since learned that led to more negative outcomes and have tried high-flow oxygen and other treatments to improve oxygenation in patients' bloodstreams. I know a little bit about the procedure from my experience working at UC Davis Hospital in the recovery room and the operating room for now 11 years, so when they told me that my sister had to be intubated again, I panicked, Gadlin said. She had already been intubated. She had already had a difficult time, and from that difficult time, she was recovering. Melody was the first baby for Hankston, McDaniel said, and she was scared. Because of procedures implemented to limit the spread of COVID-19, Sutter Medical Center and other hospitals are not allowing family into their facilities. I told her to trust in God, that she was going to be all right, to just have God on her mind. She was scared, so we left each other on the phone, saying goodbye, and I haven't seen her since, McDaniel said. McDaniel and Gadlin said they can't get answers from Sutter staff about what happened during the procedure performed just before Hankston's health spiraled downward. Since star athlete Serena Williams and platinum-selling singer Beyoncé Knowles both experienced potentially fatal health setbacks during their pregnancies, public health officials are shining more light on the disparities in care faced by Black women. Sacramento County, in fact, launched a website where they provide insights into the disadvantages African American women face when seeking obstetric care. Black women are 4 times more likely to die from pregnancy-related conditions such as cardiac issues and hemorrhage. Their babies are twice as likely to die, too, county public health officials state. These deaths are not explained by income, education, or unhealthy habits. Despite increased income, access to insurance, and academic achievement, they say, the mortality rates for college-educated Black women and their babies are often no better than for a white high school dropout on Medi California. What is the difference? County health officials say it plainly. Daily experiences of racial bias and discrimination are contributing significantly to health inequities and disparities. More than half of these deaths are considered preventable. Gadlin said she wonders whether the combination of her sister being a COVID-19 patient and a Black mother doomed her chances of walking out of the hospital. African Americans make up 6% of California's population, but 8.3% of state residents who are dying from their respiratory illness. Can they honestly say that they followed proper protocol? Or did they mishandle saving her life and her care because of her situation, being an African American mother or a COVID-positive patient concerning and threatening to your staff? Yep.
All right. So, our beautiful queen is brain dead. Now, she went from laughing and talking, calling one of her relatives every 2 hours, and something along the way went wrong. They don't listen to you. They don't. If you get somebody that is biased and feeling some kind of way, and you don't know if the staff, they talk about patients, and you don't know if they all have a bias, that they get up in their feelings. And we have to keep in mind anyone that is in the hospital are also dealing with their mental health. So she, had to have an emergency C-section. Then she's dealing with compound medical issues. I mean, that's a hell of a mix. And the administrative department is not communicating with the family at all. So that's why it's so important that we put these videos up to put more of a spotlight on the atrocious behaviors in these institutions that we have to continue to deal with, And, the other part that's sad to me, there was a space and time where we had our own hospitals and all of that. And, there was also a space and time our money wasn't good. But now, because they want to hog up everything, and they want that money from us too, even though they want it, but there's a certain amount of care that we get. And I've heard this before. You can be a Black college-educated woman, and you can get the same amount of treatment if you are a Black teen parent and poor. Let's mix that in there. So, as we continue on, let's listen to our Queen's family. take this back. Blow this up.
Calling for justice for a situation that is so heartbreaking. Literally last Monday, I got a phone call that said that Kiana was in the hospital struggling, and her story goes like this. She was going into the hospital for stomach pains, had stomach pains, 23 years old, because she was 6 months pregnant. And with that, she had to undergo an emergency C-section due to the coronavirus. The rest of the week, she was fighting strong. She was even going and standing up, going to the bathroom by herself. She was eating by herself. She was showing signs of recovering in the right way. She then had to undergo a surgery based upon doctors due to a blood clot. They performed this blood clot not in the traditional way that they perform their procedures, but they did this procedure at her bedside. They did not follow proper protocols that they normally would follow for a procedure like that. And as a consequence, she has zero activity in her brain. She is brain dead on life support in the building that is right behind us.
It was so much fun. Everybody she was around, she kept me young. She was very much so into fashion, so everything glitter and pink was her thing. And can they honestly say that they followed proper protocol, or did they mishandle saving her life and her care because of her situation, being an African American mother or a COVID positive patient? Concerning and threatening to your staff. The course of action they took with my baby sister was inappropriate and completely insulting. There were too many inconsistencies in the care that my sister received, and I can assure you that COVID-19 was not the cause of my sister becoming brain dead, nor her lung collapsing. To the doctors and the staff at Sutter Medical Center, what would you have done differently had she not been Black? Are you competent and capable enough to care for an African American COVID positive patient in your facility? I want Kiana's story and experience to be a turning point for other African American COVID positive patients who come for treatment here. I want to be reassured that my little niece, baby Melody, is receiving the best possible care without bias because of the color of her skin or her medical condition.
And we just want answers for my baby. I want answers for my baby, and I'm gonna fight until I get answers for my daughter. We're a strong family, and we're gonna stick together through this, and Kiana needs justice.
All right, my royal family. Let me shut this down. I'm going to take it all the way down so I won't get any pop-ups here.
We just keep the faith. That's all we can do.
We'll hold that for just a second. Let's get over here. What is disturbing to me, my royal family, is that Kiana Cousin said the procedure that they did was at bedside. Okay, now think about this. You got coronavirus. Thick. That atmosphere in that hospital is thick and full with coronavirus. And you're not in a clinical setting in order to get a procedure done. I don't care how minute it is. So you're just going to do some bedside shit, and you're not going to have everything there if something goes wrong. That's why when you're getting an operation, they have everything there to deal with any type of mishaps. So this further shows me that whatever mishaps that happen doing a bedside procedure. This is the first time I ever even heard of a bedside procedure. Something went terribly wrong. And now this beautiful queen is sitting with on life support, no brain activity whatsoever. And I know what that's like. My husband's oldest brother was in a situation like that. And I watched him die before my eyes. You know, I had to watch my husband's family go ahead and agree to pull the plug. And it's hard to watch somebody literally die in front of your face. You won't ever forget it, ever. Because when he was dying, he was grasping for breath. And my husband asked one of the medical personnel, how long is this going to happen? He's going to be in this condition. They said it could be hours he can fight or minutes. They don't know. So as he was dying before us, we opted, because it was so hard to step out. And trust and believe, by the time we got on the road, he passed over. I just thought I would share that. So let's get into this last video, because I want to hear more about hear what the family have to say. Is extremely important. So let me refresh this so we can get the full story. Okay.
We can't do.
Kiana Hangston's family can't be beside her hospital bed, so instead they're outside of Sutter Medical Center, joining in prayer.
There's no human out here who can help make this better but the Lord.
The 23-year-old is on life support with no brain activity after testing positive for COVID-19 and having an emergency C-section. Her newborn daughter Melody also has the virus and is in the NICU, according to the family.
I can't eat, I can't sleep. Every time I close my eyes, I see Kiana screaming, telling me how wrong they were doing her. And I'm just hurting because it's not fair.
Karina McDaniel says her daughter started complaining of severe stomach pains on July 19th. She was 6 months pregnant. They rushed her to the hospital and learned she had preeclampsia and the coronavirus. Over the next few days, family members say Kiana underwent several procedures, with Melody being born on the 24th. They FaceTimed a few days later and thought she was getting better, until
they called and said they had to have a second surgery because they see blood clots in her stomach. She was so scared. She said, Mommy, they're not treating me right. Mommy, I'm scared. I'm scared.
That was the last time she spoke to her daughter, learning on the 30th that Kiana was brain dead. The family questions whether the hospital followed protocols, now calling for an independent investigation into exactly what happened. In a statement, a Sutter Health spokesperson says, quote, providing compassionate, safe patient care is our highest priority and the core of our mission. Our commitment to patient privacy as well as legal requirements prevent us from providing additional information. But this family's not giving up.
I was born a fighter, and I'm a stay a fighter. For Kiana, I'll fight until I die, and I'm going to get some answers, one way or another.
In Sacramento, Jessica Medj.
So, I know that sound may have been low. And so, let's get back over here. So, this is, she has several clots. And so what I question is, did they give her anti-clot medication in the situation that she was in, saying that she had to have several procedures? And, you know, when those clots can cause you to have a stroke, they can literally cause you to drop dead, be brain dead. It goes straight to your brain if that is not addressed. But what I can't get past is this beautiful queen had some type of bedside procedure done. That's the part that this messes with my psyche. I can't get past that. And you know, we have to be greatly concerned when we step into these institutions, and racism is always on the streets of America. Racism is in these buildings of America. Racism is sitting there when you are at work, at school, going shopping, literally walking. And then let's throw out coronavirus. The plagues are truly here to stay, my royal family. And our queen was left no other choice but to go to the hospital dealing with her pregnancy and issues around that. She had no other options. And then somebody feels some kind of way and, just do a half-ass job. I never forget when Oprah used to have her show back in the day, and she had Maria Shriver there. And Maria Shriver, that was the one that was married to Arnold Schwarzenegger. And she was talking about her mother. Now, these are Kennedys, did not receive the greatest care, and she had to really advocate hard for her mother, these white folks. And so the message that I'm giving the royal family, these are another conversations that we need to have in our individual households, that you can, you don't have to be sick, but you can get paperwork. I forget how they do that. I don't know if it's power of attorney, but you can have somebody that you can, I don't think necessarily it's power of attorney, because that would take over everything, but that somebody could make decisions and advocate for you, knowing the situation where they have designated a person, if you're not married or something like that, that this individual can make the decisions for me, because you're going to have a conversation with them anyway if something happened, what you want to be done. And you will also give them the right to know what condition that person may be in, because and stuff like that. This is extremely important, my royal family. This story is extremely sad, but this is what we have to deal with in America. Sometimes we are put in situations where we have no choices but to go to these institutions that are built in racism, built to be biased towards us, and they feel some kind of way if they have to serve us. And so they'll be very dismissive in our treatment, half-ass, and all the other negligence that could incur in this type of situation, where literally they are cradling you in their hands. And for her to let her family know, these people are mean, these people are treating me in this particular fashion, our beautiful queen felt deep within herself, this outcome is not going to be right. I know she wanted to go home. For her to have the determination to be able to use the restroom on her own, to walk on her own, she was trying to get up out of there because she felt something. That's why I say we're empathic. Don't ever dismiss what you feel, the very thing that our Father blessed us with. Honor what you feel within thyself. Talk to somebody that you could truly trust, especially when you're in these type of situations. So I'm going to get on off of here with my royal family. This is so sad to me. So render your voice with your beautiful divine words, and it's always my royal family. I thank you for your love. I thank you for your support. And with that said, Ashe. What a shame, Father.